This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And I am happy to be joined now by Dr. Nagesh Simha, who is the president of the Indian Association of Palliative Care. Hello, Dr. Simha, how are you?
I'm doing very well and honored to be here at ESMO 2012.
Well, you are joining us to talk about an area that is emerging as a priority subject amongst the medical oncology community, and that's the area of palliative care and pain management, which for me is really a quality of life issue. As the president of the Indian Association for Palliative Care, for patients dealing with pain, the medications unfortunately carry their own issues. Sometimes patients will say, I want to be more alert, or the constipation. That's a tough thing, especially for patients that may be dealing with GI cancers or gynecologic cancers, where constipation can actually create even additional pain.
Well, let me tell you something interesting. Constipation is a very, very major issue in India, for the simple reason that culturally, if one doesn't move his bowels at least once a day, then he or she feels that that he's not clean. And therefore, I sometimes joke with my patients that he or she has no constitutional obligation to move his bowels once a day. And we need to educate our patients that constipation is a problem. There are a lot of other issues about opioids and morphine in particular. There are myths about morphine, that morphine is given only in the late stages. So somebody says, oh, he's already on morphine, that means it's all over. The fact that, or the myth that morphine causes is addictive. And some of the respiratory depression, for example, is a major fear. In fact, many of my doctor colleagues don't know that we treat respiratory distress with morphine, and very successfully we treat that. So it's a multi-pronged attack, and it can be sometimes very frustrating, but we have to keep going at it.
Dr. Simha, in the countries where there is a mobilized advocate community, do you think that we can have an impact and an influential voice to help motivate and inspire and direct change?
Certainly, I think that is a very good idea. And it has been successful in various aspects of life all over the world, including in India. But when you're talking about advocacy in terms of patients asking for palliative care to be integrated with, let's say, their oncological treatment, the sad situation is that 75% of our patients reach the doctor when the disease is already advanced. Forget about oncological treatment. Even basic medical care is not available for a large section of the population. They're ignorant, illiterate. There's always this attitude that the doctor knows everything and he's almost like God. And therefore, while advocacy on behalf of the patient may be a very good idea and is happening in a small way in India at the moment, will it have a significant impact for, let's say, the next 5 to 10 years? May not be. But I'm not frustrated. I feel that we should keep going. And it might have a ripple effect, and at some point of time, it might work.
It's troubling when you think about physician bias or physician attitudes that really impede the process for the patient. And there's really no place for that, because that attitude or it's almost a stigma.
It is. It basically boils down to the paternalistic way of practicing medicine or healthcare. But I think it's changing slowly, and more and more people are realizing that.
Your next steps are what?
It's kind of very interesting that at this point of time, two things are happening. The Narcotic Drugs and Psychotropic Substances Act, which is the law that governs this, an amendment bill had been sent to the cabinet with the intention of sort of making rules a little more simple under pressure from the international community, the Narcotics Control Board, as well as the patient community. And of course, let me also give credit to the fact that government, after all, consists of people, so they also do realize that. But the bill that was sent was half-baked, and we managed to press the right buttons and got that bill withdrawn. And in fact, I'm meeting with the top bureaucrat once I go back to India on the 8th of October. The second thing is that we had filed a public interest litigation with the Supreme Court of India 5 years ago, and that has come for the final stages. And the two-judge bench has passed very strong strictures against the government, and said that pain relief is a important thing, a human issue, and therefore they have directed the government to take action on that. So I think with the Supreme Court judgment and with us lobbying, with a very helpful media, I think it's not stereophonic, it's quadraphonic sound that's going on, and it'll take time, but I think we're a little more confident than we were before that we're reaching the place where we need to go.
Well, I'm hoping the time you've spent with us will assist you in your efforts.
I do hope so, and I believe one thing: nothing happens without a purpose. Please remember that in your life.
I believe that. Thank you, Dr. Nagesh Simha, President of the Indian Association of Palliative Care. Thank you so much.
It's my pleasure. Thank you very much.